One of the most important things you can do on your visit to the veterinarian is to engage in a little small talk. Often we forget, or maybe we're just really too embarrassed, to talk about any problems our pets are having regarding behavior. Dr. Kate Crumley, president of the American Animal Hospital Association, says, let's chat.
You begin your appointment and you say, well, how are things and how are you doing? And typically folks will say, oh, fine. And then you get on and you find out that, yes, the cat's been missing the litter box for years.
Dr. Crumley says chatting with your veterinarian about these issues will help you to find out if anything is medically wrong with your pet, and even if it is a behavior issue, your veterinarian can help.
Even if it is truly behavioral, there are things we can do now to help, and it's no fun. Just think about quality of life for your dog who's chronically anxious, or your cat who is not getting along with the other cat in the household. Do you want them basically to be chronically anxious? That's a form of suffering. And there's lots of things we can do to help. There are medications now that can help that are very safe, very good long term. And so that's if it's strictly behavioral. And then you have to find out, well, perhaps they're not acting like themselves because something hurts. I've seen animals with chronic ear conditions. Their ears hurt. And if you can fix the ear condition, or their teeth hurt, and they're not going to complain.
Tackling these problems head on will often mean solving these problems. Now that could mean actually saving your pet's life. I'll tell you, when behavior problems go on and on and on, sometimes that bond fractures and then the pet is in jeopardy of actually being given up. Yes, your loving pet. So that means your pet will be happier because the problems will be solved. And of course that means you and your family will be happier too. And after all, that's all we want, is a loving and happy home for all our family members. Learn more at aha.org. I'm Steve Dale.